Balor, Martel, and SGR. I'm delighted that with continued receipt of more ethanol through the partners of other government agencies, KPC and its partners is revising the initial target of producing 1 million liters of sanitizer to 2 million liters, and for this we commend them. This will indeed boost the requirement to have as many Kenyans as possible sanitize their hands. I would also like to caution everybody that this is not the time to engage in politics with donations that have been given by well-wishers or corporate entities. Fellow Kenyans, since our last briefing yesterday, we managed to test 491 samples. Out of this number, 2 have tested positive for coronavirus disease, 1 in Mombasa, 1 in Nairobi. This now brings the total to 191 cases of confirmed cases in the country. One of these cases is a Kenyan and the other is a foreign national. None of them has a recent history of travel. The 2 cases were picked by our surveillance teams, and one of these cases is aged 2 years old and the other is 32 years old. A total of 2,054 contacts have so far been monitored, out of which 1,546 have been discharged. A total of 508 contacts are being followed up at the moment. Out of the 191 cases, 109 are male, whereas 82 are female. And in terms of age distribution, 124 are aged between years 30 and 59. 50 cases are aged between 15 and 29 years, and 7 of these cases are aged 60 years and above, while 2 of them are under 2 years of age. Today, 2 more people have been discharged from hospital. Cumulatively, this now brings to 24 the number of Kenyans who have recovered and been discharged from our health facilities. And finally, dear Kenyans, as we continue to celebrate Easter holidays in our homes, let us reflect on what we must do in order to contain the spread of infections. We must remember to wash our hands. We must remember to continue observing social distance. We must continue to wear our face masks, and we must continue to stay at home. I thank you.
Is it working for us? Finally, is it working? And remember that it was being projected that the numbers would increase, but as it stands, yesterday we had 5, today 2, and we are moving towards 0 infection. Are we on the right path? Are the systems and the mechanisms being put in place? Are they working? And then the second one is, there has been a complaint from the medics. A section of them will say that in as much as the SRC actually announced the new motivations, they don't feel quite motivated. They say the rates are too low. And maybe you could just respond towards that. Thank you.
I'm Nancy Okware from KBC, and looking at what China has been going through even after easing the lockdown, there have been fears of a second wave right there and also in other countries. So as the Kenyan government is planning towards combating the coronavirus, what are you doing looking into the future after we've cleared this virus right now? What is the government doing to ensure that we do not risk having the second wave right here in the country?
Thank you. Thank you all for these questions. I'll begin with the first question concerning our Kenyans who are in quarantine centers. Indeed, this is an issue that has been addressed several times. The Kenyans who are in quarantine centers are actually Kenyans who have protected the entire country in, keeping into quarantine and ensuring that we can contain any infections that may come about in quarantine. We do appreciate that a large number of these Kenyans are in different hotels across the country, and as we have previously briefed you, we shall be reviewing the issues of who takes care of those accommodation costs on a case-by-case basis. We are aware of the issue happening in Pride Inn Hotel, and we have a team that's working together with the hotel to ensure that the matter is sorted in a manner that is amicable. So this is a case-by-case review, and it's going to be undertaken. Now, with regards to mass testing, and I'll tie this question along with what our strategy would be within the 21 days. One of the things that we are looking at within these 21 days is scaling up our testing ability. Indeed, the gentleman has asked whether we're on the right path. And it's important for Kenyans to know we are working with different teams, Africa CDC, the World Health Organization, and different consulting groups who've all shared with us their different models. When we look at these models, it's always important to know that a model has certain assumptions, and therefore, as you employ different interventions, the model might not always hold right. What we do know, however, as we try and scale up mass testing, we are bound to get more cases of coronavirus within our population. And so the next 2-3 weeks will be very important for us as we first start with targeted testing of the quarantine centers, then for our healthcare workers, and then rolling out the mass testing in the different institutions. Again, it's important to note that we are looking at our different laboratories within the country. I'm glad to announce that we are scaling up and more laboratories are engaging in the testing exercise. We do even hope, perhaps in the coming 2-3 weeks, to engage some of our facilities that have been testing for TB across the country. Almost 193 machines that are available. So this is a case-by-case issue that we are looking at, and we do see that mass testing will indeed pick out the positive cases and will then be able to combat coronavirus disease. There's another question that has been asked concerning the SRC rates and concerns that these rates may not be adequate. It's important for us to understand that our healthcare workers remain our top priority. In this fight, if anything, they are the heartbeat of us winning this fight against coronavirus. So there are different organizations and government agencies who are reviewing that package of healthcare workers to determine its suitability in enabling them to be able to muster up enough courage and energy to be able to fight this battle. This is an issue that's being discussed at NERC. The NERC team, consisting of different cabinet secretaries and chaired by our cabinet secretary, will be able to give a way forward on this in the coming briefings. I'd ask the DG to come in and elaborate further on the issue of automatic testing and to provide more clarity on this issue. Thank you.
Thanks, Madam CAS. In terms of mass testing, yes, we have received kits from Roche Diagnostics, enough to be able to test 7,000 persons. And we will be able to deploy this in Cambridge, where we have 3 machines. We have another one at Kenyatta National Hospital, a fourth one at the National Influenza Center, another one at Moi Teaching Referral Hospital, then the 2 last one at Kemria Lupe and Coast Provincial Hospital. So as we prepare for mass testing in the next 2-3 weeks, this is what we are going to deploy. And the beauty of what we are going to deploy is that now we'll be able to do more tests in a shorter time. The Cobas 8,800 machine can be able to do 2,000 to 3,000 tests in about 1 to 2 hours. So in about 2 hours, we can be able to test 2,000 to 3,000 Kenyans in one facility. So if you multiply that by the number of sites that we can be able to deploy, then you can see it's a huge potential. The only limiting rate, of course, will be availability of the testing kits based on the global supply chain challenges. But even as a ministry, we are really working hard to be able to ensure that we can be able to procure more testing kits so that we utilize these machines to reach a bigger population so that we can be able to tell for sure where we are, as Seth was asking, in terms of whether we are winning the battle or we need to change our strategy. But so far, everything is according to our projections. We plead with Kenyans to maintain personal hygiene, ensure social distancing, and stay at home. And possibly, if we continue this way, we may be able to overcome the challenge posed by COVID-19. Thank you.
When Chinese in Kenya were facing sort of xenophobic attacks, the government came out strongly to defend them. But Kenyans in China are also facing similar situations, and the Kenyan government, Foreign Affairs, sent a statement, but it really didn't have as much weight. What is the government doing to ensure those Kenyans there are safe?
Yes, Foreign Affairs issued a statement on behalf of the government regarding the situation of Kenyans in China, and our embassy in China, of course, through the local Chinese embassy and ambassador here, we are in discussions to ensure that Kenyans who are in China are protected and their rights are not violated because of COVID. The same way we protected the Chinese here, we expect them to reciprocate and ensure the safety of Kenyans who are in China. The second wave of preparedness, fortunately for us, we are lucky that we can be able to learn from other nations. We are learning from events in China. We are learning from events in South Korea. What happened in Italy, what is happening in the United States of America. It will closely be informed by the lessons that are learned from those particular areas, and also in consultation with WHO, Africa CDC, and US CDC, and of course our local statistics. Based on that, we'll be able to craft a way forward on how to continue with the battle.
Could have attributed towards that. When you look at our neighboring Tanzania, the cases are still way too low. But in terms of East Africa, we are leading by a very significant margin. What could have attributed towards that?
The clear and straightforward answer to that is that Kenya has tested more than any other country in the East African region, so we are able to pick up more. So as they ramp up their tests, of course, their numbers will also significantly rise. And these numbers will rise further as we go to mass testing when we go to the community level.
Fantastic.